Just for the benefit of viewers, that's not hand wringing, that's hand sanitising. Kia ora koutou katoa. Look, before we start today, I'm going to hand over to the Director General of Health for an update on the Delta outbreak in Auckland.
Thank you, Prime Minister. Kia ora koutou katoa. So today there are 19 new cases in the community to report. 18 of those are in Auckland, and one is in Northern Hauraki, a student at Mangatangi School who is already in isolation. Today's cases take our total number of cases in the outbreak to 1,249. There are also 6 cases in managed isolation to report today. Now, of today's cases, 16 are known household or other contacts. 1 is a household contact who had not previously been identified, and 1 is a possible contact. And looking back to yesterday's large number of cases, just 4 remain unlinked at this point, with investigations ongoing. So Delta's high infectiousness is played out within household, and that underpins some of the numbers we've been reporting over recent days. We know from a number of the already notified contacts in our system, we're expecting another 30 or so cases over coming days from day 5 and day 12 testing. And just regarding where our current cases are coming from, 19 of our recent cases are linked to transitional or emergency housing. This is some, but by no means all of our new cases. Now, just going back to Mangatangi School, as I mentioned earlier, one of those is a student from the school in Upper Hauraki who has been isolating at home for the last 10 days. The positive result was returned because the student became symptomatic and was tested around day 11. A small number of household contacts of the student are being followed up by the public health staff today. The student is one of 98 who have now received day 12 tests, both students and staff. 96 negative results have been returned, this 1 positive result, and the final outstanding test is expected to be done today. The student was initially tested negative, but was retested, as I say, when they did develop symptoms in the last few days. As this case has been in isolation at home, the risk of spread is currently regarded as low. The student is transferring to a quarantine facility in Auckland with a family member. Now, while not included in the case numbers today, there is a positive result in a managed isolation work at Nomi Hotel in Auckland. This case is still being investigated to determine if it's border-related or part of the existing community outbreak, and urgent whole genome sequencing is being done to help shed light on this. The worker is, of course, fully vaccinated and was last tested on the 14th of September, and this positive result was picked up again through regular fortnightly testing. Public health staff are just making inquiries today to check if any other staff or returnees require additional testing or other action. And on the subject of testing, you'll be aware there is both targeted and surveillance, wider surveillance testing underway in Auckland. There were over 11,000 tests taken across Auckland yesterday, and thank you to everybody who was tested. Our suburbs of interest have been updated. Otara is no longer one of those suburbs of interest, and Henderson and Papakura now are. So we want people in the suburbs of interest. The other ones that are still there are Clover Park, Mangere, Favona, Manurewa, and Mount Wellington/Sylvia Park. If you are in those suburbs, please come forward and get tested, whether or not you have symptoms. This is to ensure that we both find symptomatic cases but also undertake surveillance testing to check if there are any unidentified chains of transmission. The testing teams in Auckland are also going out to around 40 transitional and emergency housing sites over coming days to offer testing to all those residents there. Most important, though, for people anywhere they are across the motu is if you have any flu or cold symptoms, no matter how mild, go and get a test. On to Tauranga, as has been reported already today, just confirming that follow-up 24-hour collections of wastewater in both Mount Maunganui and Tauranga have come back negative. There will be further follow-up testing in coming days just to provide further reassurance there. And back to the subject of long COVID, we're learning more and more about their long-term effects of COVID-19 infection, what is now referred to as long COVID. To be clear, long COVID is real. A new study by the University of Oxford and the UK National Institute for Health Research found more than 1 in 3 people with COVID-19 will experience at least one symptom of long COVID. This study included more than 270,000 people recovering there. They found 37% of patients had at least one long COVID symptom, diagnosed 3 to 6 months after infection. The most common symptoms were breathing problems, abdominal symptoms, fatigue, pain, and anxiety or depression. Now, although people who get flu or other viral illnesses can also have prolonged post-viral symptoms, the study found the symptoms linked to COVID were 50% more common than those in those who had COVID compared to people who had had flu. And finally, I would like to acknowledge a free new taxi service which begins in Auckland today to help get more people vaccinated there. Auckland's co-op Blue Bubble taxis will transfer people who have previously been unable to get to vaccination centres for free. This service is those having their first doses only who are either unable to drive or can't access other forms of transport. It's open to whānau bubbles of all sizes, as shuttles as well as taxis are also available. A great initiative. Back to you, Prime Minister.
Thank you, Dr. Bloomfield. As you can see, there has been some volatility in cases in recent days. At this stage, though, we continue to have broad control of the COVID outbreak in Auckland, and control is key. We simply do not have enough people vaccinated in Auckland or in New Zealand to tolerate a widespread outbreak. But maintaining that control is not a given, and the public health team in Auckland need our help. Firstly, while we put on the individual armour of the vaccine, we still need the restrictions that we're using. I know they're hard. I know they're incredibly hard, and they will ease. But for now, they're doing a job for us. That's why we need people to keep following them. And this is also an important time to remind people that this is not an outbreak that is in one part of Tamaki Makaurau. In fact, we have a cluster at present in West Auckland. That's why we need everyone on high alert, but with a particular focus on some of the new additional suburbs we've talked about today, Henderson and Papakura. We're asking people with even mild symptoms to be tested in those areas, but again, across all of New Zealand. If you have symptoms, please be tested, but particularly Henderson and Papakura we're adding to our list. The second ask, again, as always, is vaccines. Since the outbreak began, Aucklanders have turned out in force to get vaccinated. And they've done a brilliant job, but there is still some way to go. We need everyone to be double vaccinated. We know it can and will make a difference, even for this outbreak. Only 3% of our cases in this outbreak were fully vaccinated. Obviously, the vast majority were not. Vaccines matter. They keep us safe. They're helping us to control this outbreak, and they will literally give you choices in the future. 83% of eligible Aucklanders have turned out to get their first dose, and across the rest of the country, 80% of those who are over the age of 12 have either had their first dose or are booked for their first dose, which is fantastic. But we have seen that achieving 90% is possible. Groups within New Zealand are already showing us this. Nationally, 92% of our over 65s have had their first COVID vaccine, and nearly 90% have either had or are booked in to have their second. It is possible to hit 90, and we need everyone to put that effort in. That's why it's great to see regions across New Zealand are entering into a bit of competitive spirit, with Canterbury businesses launching a 90% We're Worth It campaign, and the top of the South attributing their high vaccination rates to freezing work visits and stadium clinics. Local chambers, councils and businesses are showing incredible leadership to drive up our vaccination numbers. They know, as I know, that we can be world leading in getting our population vaccinated. And while vaccinations are being available at more than 1,400 different places to date, sometimes it is a matter of getting there that gets in the way. That's why I do want to, again, reiterate the new service that Dr. Bloomfield has just mentioned, a free taxi and shuttle service to get people to community vaccination centres. As Dr. Bloomfield said, it's available from tomorrow for families of all sizes who can't drive or don't have transport to be vaccinated. If you are someone who needs this service, you can contact 0800 28 29 26. That's 0800 28 29 26. That's a vaccine helpline. Also today is the second day of a drive-through vaccination centre for Te Walu, Kiribati and Tokelau communities in Te Atatu. at 40 Kitty Avenue, and it's running until 4:30 p.m. today. On Friday and Saturday, there is a pop-up drive-through at Henderson High School, and another for the Samoan community at the Vodafone Event Centre. There is also a testing and vaccination 2-day session beginning at Bunnings and Mangatangi in Manukau today. So if you're popping down for some click and collect, you can also be both tested and vaccinated at the same place. If it's time that is stopping you from getting a vaccine, please can I ask again employers to give your employees the gift of time and encourage them to get their jab. You know as I do that people are always our greatest asset, and is there any greater way to show your employees that you care than by keeping them well? Please do it today. It is, of course, our ticket to greater freedom and greater control. Before I hand over to questions, I want to acknowledge the significant policy announcement that was made today on the pathway to residency. We've talked a lot about the team of 5 million. Some of that team had been here for the entire time of COVID, but on visas that haven't given them certainty for the long term. Some may have been here more recently, but have skills that are scarce and that we need to hold on to. So for those who are settled, skilled and scarce, we are offering a pathway to residency that acknowledges the one-off situation we are in with this pandemic. This represents the most significant announcement in immigration policy in recent memory. It is one that we've been working hard on behind the scenes for many months, but one we are also very proud of. I know this will be a welcome move for communities, for employers, and for the team of 5 million as a whole. Minister Chris Whāwhoi will answer questions on this announcement at the conclusion of this stand-up, so roughly 1:30. We're now happy to take your questions.
A kind of triple A vaccine question.
Sorry,
a triple
sure.
triple pronged vaccine question. Will those cabbies have to be vaccinated? Will you vaccinate if you're going around those 40 transitional housing places? Will you also encourage vaccination there as well as testing? And of the total case numbers, are you also encouraging those people, given their majority unvaccinated, are you encouraging them to get vaccinated and provide?
Yeah, I can pick up the last two. On the arrangements around the taxi service, I don't have that detail, so I'll leave that one to Dr. Bloomfield. On the transitional housing, the initial focus of the team is to go through and immediately test, and they want to do that really quickly and efficiently. So that's the initial focus. They are already making plans to then return with a vaccine program for those who have not already been vaccinated. So that is part of the planning. More broadly, we're taking that approach generally with communities that we're having contact with because they're being identified as COVID cases or COVID contacts. So conversations are happening almost immediately about the future, if they are a positive case, around making sure when the time is right to vaccinate family and friends as well. And I'm told that many of those conversations are incredibly positive because people fully understand the impact of COVID.
Thanks, Prime Minister. Just on the testing vaccination, the team in Auckland is moving to roll out more combined testing vaccination opportunities, and there's one today at the Manukau, outside the Manukau Bunnings, which I think there's a mitre 10, and it's quite a big car park, so you can go and get your vaccination, and a free test thrown in as well. So same bus, different sides of the bus.
Is there a sausage?
Bound to be. You can judge whether the mitre 10 or the Bunnings sausages are better. On the question about the cabbies, they're not required to be vaccinated, but I would be very surprised if the cabbies in Auckland, not just in the blue bubble, but other cabbies haven't been vaccinated.
Level question. If Auckland does move to level 2 on Monday, would you consider keeping the boundary in place so people can't leave the city but they can have a bit more freedom within?
What I would like to signal now is the high likelihood of that boundary remaining. And I think I owe that level of certainty to Aucklanders. With the outbreak as it stands, yes, we are giving full consideration to easing. But there's a number of ways that we can consider that. And those are all the conversations that we are having now based on the data and information that we have. But what is not in consideration presently is the idea of removing that regional boundary at this time. And so I'm very happy to give that clarity. I know that will be hard to hear, but it is not one of the things we're currently considering.
How big a taxi fleet are you offering, and is this a government-funded initiative?
to Dr. Bloomfield.
I'll have to come back to you. I'm not sure how big the Blue Bubble taxi fleet is in Auckland, but I think it's one of the largest. And as for the funding, we'll come back to you on that.
Well, yeah, obviously we're funding it as part of our vaccination program because it's a free service.
And you're intending it to run for quite a while?
Oh, I haven't got the length of time that we're running it for, but we do know that we're doing this at the same time that we're going into people's homes where they have accessibility issues. So that's where for our disabled community, we already have a program that allows us to safely vaccinate in home. That's, as you can imagine, a reasonably confined number of people. But we know that there are those who just have transport issues. So this is about that middle group. It's not necessarily that they have a disability that prohibits them, but they have a transport issue that prohibits them.
Are you able to give us a bit of a broader picture about...
Yeah, sorry, Derek and Gina.
Are either of you able to give us a bit of a broader picture about where we are with the outbreak at the moment? Are we still looking at, I think you said before, Dr. Bloomfield, 3 active subclusters? And are we now looking at 8 or 9 suburbs of concern with the addition of Henderson and Papakura? We've also been asked about potential cases in the North Shore, in Takapuna and Albany in the past week and a half, and whether there are concerns about those cases. Maybe they're linked and they're not of concern.
Okay, I think that's 3 questions. That's about all I can deal with at once. The middle one was the easiest one. There are 7 suburbs of interest now, so Otara comes off the list, Henderson and Papakura added. On the question of the outbreak and how it's evolving, I asked this of the team this morning. So I think 2 days ago I described 4 clusters of interest that were active. There are now 2 new subclusters, one of which they're calling the Southeast Auckland cluster, household cluster. There are 5 households in that one. And then there's one just that they've just identified and talked about today, the team, which is West Auckland cluster. And it's those 2 subclusters that are really giving rise to the new cases at the moment. So of the other ones that were active, only one of those, none of those have actually had new cases in the last few days. So it's really these 2 newly identified subclusters that are the ones giving rise to the acute cases.
And just to give some context on those, we had this discussion around the source of those two new clusters, the Southeast Auckland and West Auckland. And for one of them, there appears to be a link to an existing cluster, but it's being identified in its own right. And with the other, it seems that there's likely to be another link as well to an existing cluster. But given just what the team are managing, they're being identified separately.
Other gang members and the transitional housing places, are they part of those 2 subclusters that you've identified, or are they part of the older ones?
Certainly with the southeastern Auckland cluster, there's some of the households involved are transitional housing, but there are no specific gang-related households involved in either of those 2 clusters, new subclusters.
And unlinked cases in the past fortnight, where do they fit into in the picture? And are they also in those suburbs or subclusters that you've identified?
I'd have to come back to you on that, but at the moment, our total number of unlinked cases as at the end of yesterday 15. Was, I think, 50, was
over 15. The past 14 days.
Yep, and actually... Yeah.
Okay. I think the media releases has more than that.
What we might do is come back and consolidate, because obviously, as you know, when we go back in the previous 24 hours, we're often able to draw those linkages, and that reduces down our unlinked cases. That's the report I've had on the daily today, but we might come back to you tomorrow with that unlinked consolidated list for you. Often over time, and as you'll hear us referencing, whilst we've got these 2 new clusters, we still believe that there are linkages back into our existing outbreak, even though some of them may not have a conclusive source.
There's been a positive case.
Sorry, yeah, Gina.
There's been a positive case in Albany at a group of apartments. Is that one of the unlinked cases? And if so, does that mean the spread of the virus is increasing across Auckland?
I don't know exactly, because Albany didn't come up with any of the discussions, but I think that case is linked to the West Auckland grouping, but we can come back and confirm that with you.
I have a theory on which one I believe you're speaking about, but I don't want to be wrong, so I won't hazard my guess on it.
And Pacific health teams reaching the most vulnerable, like those in emergency accommodation, saying they want more control of the response, as the vulnerable families are often dealing with multiple people from DHBs, public health, which creates confusion, anxiety. Why is there still confusion and frustration 18 months into this pandemic?
Well, I'm actually quite surprised to hear that, because that's very much not the message we're getting. In fact, there's a very clear approach now in Auckland. It's been not just in this outbreak, but it started in August last year with the South Auckland outbreak, but certainly in this outbreak very early on with that very large number of cases in households and Pacific churches. There was a strong handover, there was a very visible handover of the leadership of following up with those households to our Pacific providers there. And likewise, in the last couple of weeks, we've had these cases and groupings emerge in emergency and transitional housing. There's a specific incident management team has been set up, led by, actually not the public health unit, but by the Northern Regional Health Coordination Centre, but with a whole range of government agencies and other providers, Māori, Pacific and mental health and addiction providers involved.
I think the easiest way, we can just literally call those providers after this press conference and just try and establish what might be going on, because certainly as far as we're advised, our teams on the ground are working really closely together. We know those providers often have the closest links and relationships with family, and so we've been very proactively using them and funding them to support the response. So we'll see if we can weed out what's going on. Oh, Joe, I'll let you finish, and then I'll come over to Māori TV, yeah. If it's,
thank you.
Oh, is it related? Is it?
Mine's related.
Yours, I'll quickly finish with you, Joe, and then I'll come over, yeah.
Just on the emergency and transitional housing.
Yeah.
And it might be for you, Dr. Bloomfield, can we just get a bit more clarification? Are we talking about sort of a few households? Are we talking about sort of dense, lots of apartments? Like how many sort of places and how big is the spread potentially? Because I think yesterday, in response to a question I asked, you said 40 figure that were they were going to come and identify, test and then follow up vaccination, but I wasn't sure whether you were referring to sort of 40 houses, facilities, people. Can you just give a bit of clarification there?
Yes, so there are two parts to that. First of all, the sort of transitional emergency housing places that are involved is a mix of some sort of hostels, motels and actual houses. Because of the nature of the accommodation arrangements, people are often moving between, and so hence the links. The 40 figure was of the 73 emergency housing sort of locations or places in Auckland. The team had identified 40 that they thought were medium to high risk, mostly because of where they were geographically located, not places that have got cases already, and the plan is to focus going out to all those as part of surveillance testing and any case finding, just because there is movement often between different emergency transitional housing places.
Right, so that 40, like one could be an entire motel you're talking about?
That's
Yes.
right.
So
So,
what sort of numbers of people are we talking about?
I'll have to come back to you.
Yeah.
But I mean, potentially hundreds.
I couldn't tell you.
I have no idea. I mean, it could, if there are 40, it could potentially be hundreds, but we can come back to you on that.
But again, that's because we've identified a risk for surveillance as opposed to this being part of specific contact tracing. Yeah. Yeah.
Thank you. Dr. Blakefield, just in regards to the person who was in Kaitaia on the 17th, went to Auckland, was arrested on the 23rd, later tested positive. Can you confirm that the person wasn't infectious while they were in Kaitaia, and whether or not wastewater testing has been done in the farm, and do we know the result of that?
I can categorically confirm that they were not infectious when in Kaitaia, and there's been a pretty forensic look at that just to make sure we're 100% confident around that. I know there is wastewater testing done in Kaitaia, as in a number of places in the north, and we'd have to go back and have a look at the results to see what those showed at around that time.
The person was arrested and processed at the Waitakere police station. Is there any connection between the closure of the Waitakere police station and the current subcluster in Henderson?
Not that I know of, no, but we can just check that.
Sorry, would you tell me your Kaitaia date again that you were interested in?
17th.
We had a negative wastewater test in Kaitaia on the 21st, for what it's worth. Yeah. I'll come in here at the front and then come back to you at News Hub and then Ben. Yeah.
On long COVID, that was a stark warning. More than one in three. We have a sizable chunk in New Zealand who are already suffering from long
we do.
COVID. What's the plan for them?
Yeah.
What's in place?
You're absolutely right to point that out. I mean, although we have a small, relative to other countries, number of cases of COVID in New Zealand, there are people who, particularly through that first lockdown, who experienced COVID, well over a year ago, who continue to report symptoms I've met and spoken to several of those individuals, and it's devastating the impact that COVID has continued to have on their lives. The research here is incredibly important, making sure that our health system knows to continue to work and support those individuals, but also just working hard to prevent too many other people from experiencing potentially the effects of long COVID. But on the medical response, Dr. Bloomfield.
Yes, two things I'd like to point to. One is we've got a clinical pathway in place now for primary care to use to help diagnose and support people with long COVID symptoms. And I was reading an article about this over the weekend, that actually there are sort of 3 different clusters of symptoms that have been identified in the international research, and they're quite extensive range of symptoms. So that's one thing that's in place. And the other is we have funded a study of people in New Zealand who, and that's getting underway, people who have had COVID, to follow them to see what the long COVID symptoms are that they have and what happens prospectively in terms of symptom resolution, or what else happens.
Do any of those plans sort of involve helping with doctors' bills or?
There's no specific funding at this point. Those people would be eligible for publicly funded services, including for many in terms of accessing general practice, the usual subsidies that are there that the government provides for people to access general practice.
Yes, I did.
On average, there's about 4,000 first doses in Auckland at the moment, give or take, usually hovering under. So on some back of the envelope maths, that would take roughly 60 days to get Auckland to 90%. Is that sort of what you're planning for? Is that good enough? And how are you going to ramp that up so it's not going to take 2 months to get to the 90%?
So whilst I haven't run that exact calculation based on what we've said, yes, we are at about 83% at the moment. But what we know is that actually we have the ability to get to 90% very quickly. We have all the capacity we need to achieve that goal pretty much almost immediately. So really it does comes down to all of us. You know, the one thing we know, because we keep asking questions and trying to undertake a bit of research, one of the things we know of it, for those who may not yet have had their first dose, they really want to talk to someone who is a bit reluctant as well. So if you're someone who is reluctant to get their first dose but made the decision to do so, please go and talk to someone else. It will make a really big difference to helping them make that decision. We're at the hard end now. Those who took no convincing, they're done. We're now at the people who need a conversation, so please be one of those people who reaches out and has one.
And on the Auckland boundary, how long can we expect that to be in place?
Well, of course, we want to get to a position where we can have movement again. Obviously, it causes, a huge amount of work for managing the boundary safely, and also a huge amount of stress and anxiety for those who are separated. So, of course, we want to get that movement back, but it needs to be safe. At the moment, we do have control of the outbreak in Auckland, but we still have an outbreak. So we'll continue to assess the role of the regional boundary as we go, but at the moment, it is not one of the things I expect to be lifted on Monday.
Could it be until Auckland gets to the 90% vaccination threshold?
That's not something that we've made any direct connection to. But again, what I would say is our models are already telling us that vaccines are making a difference to this outbreak. So to help us continue manage this outbreak, to give you more freedoms in the future, potentially to access large gatherings in the future, please get vaccinated.
Just following on from that, what are some of the specifics that you'd be looking for to ease that boundary?
Yeah, and look, for us actually, the more obvious question for us is what we'll be looking for to ease restrictions. The boundary is not the first cab off the rank for decisions on Monday. There are other things that we'll be looking to that we consider lower risk for consideration. Okay, I'll take last question from Ben and then I'll hand over to Minister Farfoy.
I've got one over there and one on immigration, if that's okay. Over the last few days, we've seen John Key and the National Act and National put out their drilling plans on COVID.
Yep.
It sort of ended the political consensus. I mean, obviously, there's been arguments on the margins, but
I didn't know there was one.
Well, it's close enough to one, and now it's obviously not there. So I guess the question is, how big a problem is that for your government? Do you think it could impact either vaccination rates or compliance rates or anything else?
No, I mean, I think at its core, actually, the bones of what individuals are arguing for are still there. Everyone wants high vaccination rates. Everyone wants to have as few restrictions as possible. And everyone wants to eventually move away from restrictions at the border. All that we're having a debate about is how you phase those things safely. And my view is that, phasing is key here. Very few countries around the world have pulled away their border restrictions first. For me, that is not a safe way to manage COVID. We need to make sure we get our domestic settings right so that we can have as few restrictions for people domestically as possible before we start making those alterations at the border, and that requires good, decent vaccines.
Broad brushstrokes about immigration before the immigration.
Yeah.
I guess there's been a lot of heartache around this, the delay. Can you just actually explain why it takes so long to get those sort of policy wheels churning, why it's taken so long to get this delay, and whether you'll give a pledge of sorts to hasten the application so that it's not years in the making?
Well, actually, the reason we took time to do this work was so that when we announced it, we knew that we'd designed it in such a way that we could move a large number of people through residency applications quickly. And the other reason it has taken some time for us to develop and consider is because you'll be hard-pressed to find a decision in immigration policy in recent history as significant as this one. This is a large number of people who are already here in New Zealand making a huge contribution. We want to give them the ability to stay and continue to contribute. But that's not a switch that you flick lightly or quickly. We've considered it properly and well, and we believe it will make a big difference for those who will be affected by it. Thanks, everyone.